Dr. Howard Gluss, and I'm here at the Kalili Center. We're a bariatric and full surgical center in Beverly Hills. We're very excited to talk about today's webinar. The focus of our webinar is going to be on stress, anxiety, and depression and how it relates to our food choices and weight gain. And I want to remind everyone that if you have any question that you would like to write in and send to me, feel free to do so. If there's something that you think of later on and you want to come to our website at the Kalili Center, feel free to do so and I could respond to questions there. This is an ongoing process and we want to welcome you and have you really think about what we're trying to have to say. So when I thought about this concept about depression, anxiety, and weight gain, one of the things that I thought about was statements that my patients make to me a lot of times. And that statement is, they ask me, well, do you think that depression causes weight gain or weight gain causes depression? Now, I've looked at the research into it and it seems to be mixed, but one of the things that I wanted to say is regardless of whether it's the weight gain that causes depression or anxiety causes depression or weight gain, the bottom line is it seems to be an interchange between both dynamics and that people are experiencing some sort of depression and some sort of anxiety around their weight. So as one of my patients said, she goes, well, the problem is that when I start to gain weight, I get depressed and that makes me want to eat more. And then when I want to eat more, I get depressed. So it's this vicious cycle. So that's what we're going to address today, is this concept of how to deal with that vicious cycle. And when I was thinking about it, I was thinking about the internal process, about what goes on with us internally, psychologically, when we're dealing with these issues of depression and anxiety. And I made a list based on my clinical understanding of these issues of about 10 different attributes that seem to contribute, what people go through internally when they're dealing with weight loss. And the first thing I thought about was a sense of helplessness. That one of the things to understand is there seems to be a correlation between depression and anxiety this way, that when people get really depressed, they start to get anxious about their depression, and then the anxiety interrelates with their sense of depression, and they go back and forth between depression and anxiety. So when they're not depressed, they're anxious. When they're not anxious, they're depressed, etc. So what that creates is this sense of helplessness. People feel like they're out of control in their lives. And one of the things that food offers is it gives us a sense of control. It's one of the few things that we have control over in this world. Accidents can happen anytime. There's so much that's out of our control, but what we put in our mouth, we have control over for the most part. Sometimes it's not always the case, but so that helplessness is dealt with through that feeling of control. I can place this amount of food in my mouth, and that gives me a sense of control, and that can extend to a sense of control over my life. So the correlation is the more out of control sometimes people feel their lives are, the more they feel they may want to use control or food as a way of controlling that experience. For instance, I talked to a woman just today, and she was telling me about a divorce that she's going through. And the divorce is giving her a strong sense of being out of control. She doesn't know where she's going to go in her life, what she's going to do, etc. But food has been a big relief because she feels like at least that's something she can handle, that's something she can control. But unfortunately, it's causing her to gain a lot of weight, which is causing her to be depressed, etc. So when people are in this state of depression, a lot of times they're feeling a lot of very uncomfortable, a lot of pain, a lot of difficult feelings. So food also offers us a sense of pleasure. If I put something I love, quote, comfort food, into my mouth, I start to feel comfortable. I start to feel more at ease. So, and it's immediate. And dealing with a certain population, a lot of times the population that I deal with at the Kalili Center, where we deal with a lot of obesity issues, that food seems to be an issue of addiction for a lot of people. So when they're going through a difficult life, changes or a difficult period in their life, it's something that can give them a lot of pleasure. Just like for some people, the use of alcohol or drugs can give them a lot of pleasure. So food can help with those very difficult feelings and give us a sense of control over those difficult feelings. When we're in this state of helplessness, we also have a sense of feeling powerless over the world, that so much is out of our control, so many things we can't deal with, so many frustrations. But food, especially if we're eating foods dense in carbohydrates or sugars, things that may put on weight, it can give us a powerful feeling. I've heard this statement from several of the men. I have a men's group that I lead at the Clearly Center. It's a very unique group because we deal with the specific issues that men face when they're dealing with issues of weight loss or issues of obesity. And I've heard this time and time again from men, that they may be recognized as the big person. Hi, I'm Big Tom, and everybody knows me as Big Tom, and that gives me a sense of power. And if I lose weight, I'm going to feel powerless. But if I stay this big, heavy guy, people somehow respect me, and it gives me a sense of connection and power. So you could see that there are so many unconscious issues that happen around food in this internal feeling of depression that people face. Now, another attribute that I've seen so many times with people dealing with issues of depression and anxiety is this fear that starts to happen to them of abandonment. So I love to look at things in metaphorical ways. If you think about abandonment, if I'm a heavy person, I have a sense of identity as a heavy person. That's who I am. If I've been heavy my whole life, I identify with that person. I even identify with some of the shame that may come from being that person, some of the difficulties. But as I start to lose weight and I'm changing my body image, I may start to experience a lot of depression, almost like the loss. This is an interesting one, almost like a loss of a loved one. It's a sense of, mourning, because I'm going to let go, hopefully, of that large person for the rest of my life. And I need to mourn that large person, all the identity I've wrapped around it, if I'm Big Tom or whatever it is. So there is a sense of sadness that starts to creep into people, especially as they become more successful. The sense of mourning becomes more of a reality. Now, if that fear of abandonment, that abandonment of self, there are other kinds of fears we're going to talk about, but if that sense of abandonment starts to cause a lot of anxiety, and this is where anxiety plays into the picture, because it creates a start of emptiness, a sense of emptiness, a sense of dissociation within the person. They start getting really anxious. I don't know who I am. I don't recognize this person. They start to get really anxious, and this is where possibly self-sabotaging behavior happens, is that unconsciously the sense of not knowing who you are is terrifying for people. It feels like people report this. It feels like they're actually going crazy at that time. And one of the ways to deal with it is to go into repression. Is to go into regression. And with regression, I mean we go back to certain experiences that felt familiar, because that at least feels comforting. So this is where the concept of yo-yo dieting can come in, that people go back and forth, is that they go back to an experience, even if it's uncomfortable. We hear this a lot with people who are abused, back into an experience of being comfortable. So that fear of abandonment of self is a very powerful feeling that you need to get conscious of in this process of dealing with depression and anxiety in the process of losing weight. I love this story, and I think I may have mentioned it before in one of the webinars, but it's so important to mention it again. I was working with a gentleman, and this is the concept of a cultural connectedness, and a connectedness, I'm going to add it to his mother. So how it worked is, I was working with a gentleman at the Clearly Center. He was considering going for weight loss surgery, and he was of Italian descent. One big fear was he would not be able to eat pasta anymore. And I asked him, I said, well, is that enough to stop you from doing the surgery? And he stated that after we explored it for a while, that it wasn't just the issue of not eating pasta, that his family had huge family gatherings. And he was afraid of the retaliation that if he started to lose weight and lose weight in a dramatic way, he needed to lose about 130 pounds, that he would lose his connection to his family, that he couldn't be one of them, and that they may actually retaliate in a negative way because, and this would all be done possibly passive aggressively, that they would retaliate in a negative way and would stop him from gaining weight by being very critical of him. And in some respects, he would lose the love and appreciation of his mother, because his mother was the one who a lot of times cooked these fresh pasta meals. And he was really terrified of this experience, and this was a grown man, and it came deep into his psyche. And this was a perfect proof a lot of times, you know, that I wanted to stress to people that our unconsciousness is extremely powerful. And I hear this from patients all the time. I don't understand why I have to talk about childhood experiences. That was a long time ago. Can't I just move forward in my life? I say, absolutely. We all want you to move forward. But if it naturally comes up in your processing, in your mindfulness about in your mindfulness about being conscious over what you do, then it's something that you had to deal with. So it's only in those respects that we ask you to deal with it, because that would be saying, like, if you wanted to understand the politics of a certain region, let's say the Middle East, if you didn't understand the history that was going on in that territory, you'd never understand the current problems, you'd never know how to work with them. So you could see for him, there was this powerful connection that if he would lose weight, he might get abandoned by his family, and he might get abandoned by his mom. So that was a very powerful experience for him. There is a lot of times when people experience anxiety, they start to experience a very dissociative type of experience. They start to experience an experience that makes them feel very disconnected. And it's through that disconnection that they feel like they're starting to lose contact. Now, this happens a lot with people that have experiences of, let's say, post-traumatic stress disorder or panic attacks. So, for instance, working with a patient who experienced a lot of panic attacks, he had difficulty with that dissociative type of experience that the panic would happen. He felt like he was almost having heart attacks, and a couple times he actually went to the emergency room, and ultimately they told him he was having a panic attack. But food, and especially dense food, became an anchoring force for him. It was something that grounded him. Now, you might say, you know, did he experience panic attacks all the time that it caused him to gain a lot of weight? He didn't experience them that often, but the anticipation of a panic attack would cause him to gain weight too. And it would cause him to gain a lot of weight. And so what would happen is just the anticipation, just the thought that he put himself into a dangerous situation or in a panic situation would cause him to eat. It was like an anchor. Food became an anchor to him. So what we had to do is deal with the panic situation and then help him work that through, and help him work through the residual fear of potentially getting into a panic situation and finding alternative ways to deal with it other than food. I love this story too. I'm working with a woman, and she's dating a lot now. She's been great. She's been successful. She's losing some weight. And when guys take her out to eat, she's trying to really please them. And the anxiety that she feels about being abandoned or losing contact is You know, a lot of times these guys will start ordering things for her that are off her diet, and she's afraid of being rejected by them straight off the bat or being too difficult in her eating choices, and guys may get turned off by that. So that contact is what she's afraid of losing, and that sense of pleasing is so powerful for her. And we talked about it, and she said that, this is what guys expected of her. I said, well, it's a fine line between what people expect of you and what you're willing to give. And I understand that we don't live in a vacuum. But if you present yourself in a false sense of self and present something that isn't really real, eventually people are going to find out about that. And then they're going to be twice as angry at you because they feel as though they bought into something that wasn't really right or wasn't really true. So I know it's a difficult dance, and it's a sort of a fine-tuning of what one can and can't say. But to keep things simple and to understand that you really need to be as authentic as you can. And what she really started to understand many times was this fear of losing contact, this fear of abandonment was connected much more to her experience with her parents than it was with this experience over dating. So the more courage she could have to be that person and be herself, the more she could learn to tolerate some of the anxiety, the better off she was going to be in the long run. Which brings me to another thought when I thought about this concept of depression and dealing with anxiety. Psychologists are always talking about this concept of tolerating anxiety, that change is difficult. Real change takes a long time, whether we like it or not. A friend of mine called me up recently and he said, I know I'm not supposed to ask you this question. I know you're my friend, but I've been in therapy for a year and I'm dealing with some serious issues, and it feels as though nothing is happening and it's taking forever. And I asked him, I said, so the issue that you're talking about, how long did it take for it to come to a head till you came into the therapist's office to deal with it? And he was involved in a bad relationship, and he said about 6 years. So I said, a year really isn't that long, and it seems to have a tipping point effect in therapy. So for instance, it could feel like for a long time that nothing is going on, nothing is going on, nothing is going on, or it's not happening. And then something switches and something turns, and then suddenly you're in a new world and a new experience. So everybody that I've ever been with and in my own therapy have always had that experience that things never happen quick enough. I say that because one of the ways that people tend to deal with that feeling of tolerating sort of the emptiness and the difficult change is they go to food as a way to soothe themselves because they can't tolerate the anxiety for a long time, or they think as though the anxiety is supposed to be over much quicker. So food does soothe the emptiness, and when you're going through a lot of changes, you may actually go through more and more anxiety. Remember, change creates anxiety. There's just no way around it. It's positive anxiety. It's anxiety that creates a new world. But we all live in that place of, oh my God, is it ever going to happen? Is this new experience ever going to happen? Am I ever going to meet somebody new? Am I ever going to advance in my career? Am I ever going to lose the weight that I want? That hopelessness, or I don't want to say hopelessness, that trepidation lives within all of us. And that is a normal experience in the experience of change. Your ability to tolerate a lot of it is going to be whether or not you're successful at the change. And you should just assume that the change is going to take much longer than you think it's going to take, because real change takes time. So later on in the webinar, I'm going to discuss some ways to deal with it, that anxiety in a healthy way and not turn to food. There is this the next concept to think about in relationship to depression is there is this concept in psychoanalytic therapy and more classical psychoanalytic therapy that there's a correlation between anger and there's a correlation between anger and depression, that depression is anger turned inside out. Now, I think depression is a very complex issue. There's many different types of depression. There's major depression, there's dysthymia, there's depression that might be related to of experience. There's depression that could create psychotic-like experiences. But all of them have certain truths associated with them. There are certain depressions that are related more to illnesses and genetic connections, or psychopharmacological connections, or using drugs can create certain kind of depression. So we have to look at it in a complex way. But for our sake, I think there is a connection between a sense of anger, repression, a feeling of frustration, a feeling that we can't experience things as much as we want. We can't have the relationship we want. So again, anger for a lot of us, we're taught a lot in our culture to not express anger and not express frustration, or we intellectualize that feeling. But an intellectual understanding of it doesn't really take away the feeling. We have to find ways to express that anger and frustration. Especially, I tell this to patients, because they'll come in a lot of times and say, well, I'm just venting. I said, well, if that's what you need to do, you need to do it as long as you need to do it, because whatever insights we're trying to get to are not going to be there, are not going to pop into your mind until we get through that powerful feeling, that rage and that anger. Connecting it to food, what people tend to do with food is they tend to use food as a way to repress that anger. It's a vicious cycle. The more angry they get, the more they deal with sort of the feelings of anger, and vice versa. So what I'm suggesting is that try to find ways to deal with your anger and frustration, and not use food as a way to sublimate some of those feelings, or as a way to repress those feelings, because that's just going to only build up on the depression, and then you're going to get more depressed, and then you're going to get more anxious, and it's just going to turn into this vicious cycle. So also a couple more things. Anxiety a lot of times can represent a past history of trauma. And again, people tend to go to food to try to deal with that internalized trauma. So for instance, one of the experiences, unfortunately, I hear a lot at the doing intakes at the Clearly Center, is certain patients may come in and they have a history of abuse. And the abuse may have been so difficult that one of the ways they dealt with it is through food. Food became a drug that helped them deal with difficult feelings. A lot of times they weren't conscious of these feelings, but it was a way to soothe those feelings. So as they got into the experience of the trauma, it became so upsetting, and it was so much buried in their unconscious that, again, food had that addictive quality as a way to stop the anxiety. And they would say to me, but again, and I mentioned this earlier on, the trauma happened so long ago, why is it still there? I said, because you have to think about it. Psychic trauma can be as wounding as physical trauma. So in other words, if you've had an injury to a leg and you've broken it, maybe you've broken it a couple times, that leg may be sensitive to all kinds of pain, and it's actually like your body may not work as well as it used to, or it may ache. In my experience, I've seen psychic trauma in the same way, that if we've been wounded or traumatized in certain ways, that trauma never completely goes away. And if we get rewounded or get attacked in the same way, it can open up let's say a wound that was there before, and it can actually create more pain. So it's like having pulling off a Band-Aid and the scab is still there, and then you wound it again and it runs deeper. So one of the things to think about is what we try to do in our therapy work is to get you some distance away from the trauma so the intensity of the wound is not experienced in the same manner as it was before, and that you don't have to rely on food as a way to deal with that intensity, especially food in an addictive way. We don't have time in this webinar to go through all the different internal feelings that people experience dealing with depression and anxiety. But I wanted to make sure to give you some tools, some thoughts, some are specific tools, some are things to meditate on, how you can actually move away from this fear and move away from food as a way of dealing with depression and anxiety, and move and create more healthy ways of dealing with your issues. Think about this concept of emotions. Here's the first thing to think about, that we tend to intellectualize a lot of our experiences, and people say this to me all the time in therapy, is, okay, great, Dr. Gluss, I have an intellectual understanding of what's going on, or my mother was abusive or whatever, but I don't really know how that's going to change me. My experience has said, well, you know, an intellectual understanding gives you a little bit of sense of change, but you have to find a way to deal with the emotions around it. So you got to go from the intellectual understanding to an emotional experience of it, find a safe way to deal with those emotions, not use food to deal with those emotions, and allow yourself to re-experience some of those scary feelings. It's through the emotions that you're going to be able to grow and change, not necessarily through the intellect. A very difficult thing for people to grasp because we're so intellectually focused in society. So my advice is focus on your emotions and less on your intellect. We also tend to go to, the second thought is we tend to go to defense mechanisms, these unconscious defense mechanisms, as a way of dealing with uncomfortable feelings. So we may repress a lot of uncomfortable feelings. We may sublimate them. So for instance, food a lot of times, sublimate is we change one experience for the other. So food a lot of times can represent a lack of love. I've heard this also many times in my therapy. Well, Dr. Gluss, you know, I don't have any dates, but I have a date with pizza. I always mention pizza. I have a date with Chinese food Saturday night. That's going to be my date. So my loneliness and my feelings of wanting to connect aren't really there. So I'm going to use food to sublimate those feelings instead of having the experience of feeling connected. So you want to try to move away from those defense mechanisms through an emotional experience and try to find ways to get those needs met. So I know it's very difficult in this society to connect to people. We're so, in some ways, disconnected, but at least to have an understanding of what you're looking for and rely less on those defense mechanisms, less on food as a way of dealing with the pain, and more finding constructive ways to satisfy yourself. Third thought is the thought of mindfulness. This is a very popular thought now in psychotherapy. In the simplest way, mindfulness is just asking you to put in some thought before you have an impulsive reaction to something. So I get hurt, I'm in pain, I feel depressed, I feel anxious. Oh, I'm going to go to food automatically to deal with that experience. What mindfulness is asking you to do is put a thought in between that experience of that experience of wanting to go after something impulsively. Let's say that experience of wanting to eat too much, and try to slow yourself down. Take some deep breaths. Stop yourself. Start to think about what is really happening here. What is the deeper anxiety? Put thought in between the impulse. That's what I'm asking you to do. Very powerful experience. Sometimes we'll be successful at it, sometimes we won't, but we want to move away from that knee-jerk reaction to go to food to deal with our depression and anxiety. Building positive relationships over negative relationships. All of us, I just flashed on a thought. I did an intake today with a woman. She was great. And one of the questions I asked her is, in this intake, one of the questions was, are you concerned about what people think about you? And she turned to me and said, I'm 63 years old. I couldn't give a bleep what people think about me anymore. And she said, I've turned around and I've created some positive relationships in my life. I've recognized that negative relationships pull me down. And she said, you know, I don't have a choice in these relationships, but in my personal life, I want to be in that place where I'm not surrounding myself with negative people, because that makes me feel anxious, it makes me feel bad about myself. I start getting depressed, and then I start going to food. And she says, I don't really care, and we've discussed this, we were both talking back and forth, what people think about me. I know what I can tolerate and I know what I can't. And positive relationships make me feel good. So I'd ask everyone to do an inventory of their relationships, find the ones that are positive, and find the, you know, don't be afraid to let go of the ones that are negative. Sometimes you just can't change those relationships. And as one gets older, a lot of times one recognizes that some of those relationships are so toxic that the idea that we could change them is going to be impossible. So that goes into my next thought, is this thought about recognize what you can change and recognize what you can't change. Certain things you can influence, you can change. You can't change a person that doesn't want to be changed. You can influence them, but you can't force them into change. You can't, so you have to not be afraid to let go of certain things. That goes with the thought of building positive relationships, understanding as you get older what you can and can't change. And the next and the final thought on this is, you know, we've all had an image of a fantasy life. We've all had this image of, you know, here's my ideal weight. I want to be whatever the weight is. So, you know, I want to be 175 pounds. And as we get older, sometimes that weight may be more difficult to reach. Sometimes people work out more and they don't realize that muscle can weigh more than fat, so they actually find themselves getting in better shape, but actually not losing a lot of weight, maybe losing a lot of body fat, but they're not really testing for that. So they have a fantasy that they build up in their mind of what the ideal weight is, and maybe the frustration in, because with that ideal weight will also become the idealized sense of being accepted. You know, people will love me more if I'm that way. My boyfriend, girlfriend will love me more. My boss will respect me more. Whatever it is that we fantasize about, maybe it's something that we've learned about in the past. So, we've had that experience. What I've seen is that as people can't fulfill that fantasy, they get more frustrated. And maybe it's not a realistic fantasy, and then they start getting depressed. Then that cycle begins, and they get anxious because they're getting depressed, and they start eating more. So what I would ask people to do is analyze their fantasy life and see how realistic they're being. So with that, I want to sort of wrap up this webinar, and first of all, thank everyone for listening to it. Again, if you have any questions, feel free to contact me at the Kalili Center website. It's Bariatric Center and Full Surgical Center, which is associated with K&B Surgical that we work at. We're centered here in Beverly Hills, California. We understand that we can't delve into every aspect of this topic, but we're trying to give you a sense of all the complexities that are available. And I always like to end on this, that if you're having any kind of struggle or need any kind of help, that you need to go get the professional help that you need to get. There's no shame involved, and we want to really encourage people to do that. And this is why we're here, to educate and to inspire people to lead better and more productive lives. Thank you very much. I'm Dr. Howard Gluss.